Hello viewers, in this video we will be discussing about the necessary tests which are required for erectile dysfunction evaluation. So many people patients when they come to us, they ask us what tests have to be done, what is the need for those tests and what is the final outcome of those tests. That is the reason we are doing all these videos. So for whenever we see a patient with erectile dysfunction, then again there are so many reasons for erectile dysfunction. It can be hormonal, it can be psychological, it can be vascular, that means penile vascular damage in the penis. So now these tests should identify the possible reasons or should identify the underlying cause for erectile dysfunction. So initially what we will be doing is basic hormonal assessment, basic hormones which can cause erectile dysfunction. Like testosterone, prolactin, estrogen, thyroid, sometimes high LH, and rarely FSH won't be directly related to erectile dysfunction evaluation. To complete evaluation of testicular function, we will be doing FSH, but not directly related to ED evaluation. So now apart from these tests, then we will be doing vitamin D and B12 and homocysteine assessment. Sometimes when homocysteine is on the higher side, blood becomes thicker. So the passage of blood, the free flow of blood in the penis will not be there. So that is one of the reasons for erectile dysfunction. So we will be assessing vitamin D, B12 and homocysteine. And then we will come to vascular assessment. In vascular assessment, we will be dealing with macrovascular assessment and microvascular assessment. So here we will be doing generalized vascular assessment test for the body, where any generalized vascular cause which is affecting penile blood vessels also, that is important, because this is important in case of vascular damage. If there is any vascular damage, generalized vascular damage in the body, then we can actually identify the possible future cardiac risk and we can treat it. If the damage is only in the penis, then penile Doppler test will tell us. Penile Doppler test has to be done by giving a small injection to the penis, but most of the people are worried about this injection, but in most of the cases it's safe. It's a very small injection. Only issue is sometimes after giving this injection, patient may have prolonged erection, for which we have to give one more injection immediately. And all these injections are microneedles. With microneedles, generally painless. You might feel a small prick, otherwise they are all painless. So now apart from these things, we can sometimes even chronic prostatitis can cause ED. So if nothing, all these reports are normal, then we will be testing for prostatitis or seminal vasculitis, which can be one of the reasons for erectile dysfunction. But initially we don't be screening. But if patient is having both premature ejaculation and erectile dysfunction, then assessing prostate infection, assessment for prostate infection is must, because chronic prostatitis is one of the main reasons for premature ejaculation. So these are the tests what we do for erectile dysfunction assessment. If you have any doubts regarding this, then please post it in comment section. We will be answering those questions.